Well, ladies and gentlemen, welcome to the third plenary session. The title of the third plenary session is Korea's Future, New Growth Engine, and a Human New Deal. Allow me to introduce today's session chair. Please welcome Chairman Kwak Sung-jun of the Presidential Council for Future and Vision with one round of applause.
Okay, thank you very much for attending this afternoon session. And this afternoon we are going to hear presentations on human New Deal and new growth engines, two projects of the Lee Myung-bak's administration's key projects. And we'll be hearing commentary and analysis from related experts, and we'll be briefly opening the meeting for your questions. First of all, I would like to introduce First Vice Minister Im Chae-min from the Knowledge Economy, and he will give a brief presentation on these issues. And next, what is the sound? It's noisy. First Vice Minister Im Chae-min will give a brief presentation on new growth engines. And next, Ulf Nehabas, CEO Institute of Pasteur, who will offer his perspective on these issues. And then we'll be hearing from Hyun Oh-seok, President KDI, and Professor Richard Freeman from Harvard University. They will be addressing the human new deals. And now we'll hear from Vice Minister Rim about the new growth engines, please.
버튼이 있어요? 어디다 대고 누르면 돼. Thank you, Dr. Kwak, for your kind introduction. Good afternoon, ladies and gentlemen. It is my great honor to be here to join in on this important discussion as we explore ways to ensure peace and prosperity in Northeast Asia and beyond. And I'm sure our discussions here today will help all of us figure out new strategies for the future. My task today is to brief you about Korea's new growth engines, which is a proactive strategy to overcome the current economic crisis and also to prepare for the after the crisis. Let me begin by introducing one of the emerging high-tech products, which is the light-emitting diode. We call it a LED. Who could have ever imagined semiconductors that emit light? Those LEDs are now becoming more and more popular as energy-saving lights, replacing the traditional light bulbs and used in the latest television panels. Well, 5 years ago, I doubt there would have been many people who could have foreseen this new waves being made by these LEDs. The success of the LED is evident now, but at the initial stage of the development, there was enormous risk. You could say the transforming new innovative ideas or technology into reality is kind of like navigating through foggy waters. That fog is a risk. Sometimes the fog might be dense. the waters might be choppy. How do you reach your destination? How do you avoid the reefs? How well do you prepare for the voyage? To successfully reach the port, there are two things you must have. One, you need a clear destination with the help of a lighthouse as a beacon. Second, you need a well-prepared ship that is able to weather the storm and reach the destination. Like this analogy, there is always risk involved in finding a new growth engines. But reaching the goal, that is the lighthouse that I mentioned earlier, can be made easier if there is a clear plan and a well-prepared ship. The ship needs a qualified crew, good instruments, and a detailed map. And of course, everyone wishes for the favorable weather. So why is everyone so interested in new growth engines? The Korean companies, much like those elsewhere in the world, are constantly looking for the next big thing. It is a matter of a survival to find something new, something better, something more profitable, something more efficient, because it affects the bottom line. Adding to this pressure is the slowing growth rate, the ever-rising energy and raw material costs, the fear of new technologies making existing technologies obsolete, and the shrinking of the working age population. Let me explain our risks further. Since the 1990s, the Korea's economic growth rate continues to decrease. It stayed at 4.4% for the past few years, from 9% in the 1980s. The surging demand for energy and resources is pushing the price of oil and raw materials. Also, the climate change is emerging as a real threat. So, energy efficient and environmentally friendly growth becomes more and more crucial to all of us. We need to adjust to the times because change in technology, development, and market conditions are happening at a lightning speed. There is a constant stream of new technologies, and increasingly we are seeing technology convergence in many areas of the industry. In addition, accelerating market integration means there are new entrants into the global marketplace as traders are joining forces with various trade agreements. And finally, a low birth rate and an aging society means a shrinking working population that could seriously undermine future economic growth unless we can achieve a much higher level of productivity or make massive investments. Despite all these pressures, the companies are working day and night to come up with the new growth engines. In our case, we have many advantages to support this initiative. If you look at Korea's industrial portfolio, it is very broad and very diverse in terms of a number of industries involved. From ships to cars to semiconductors, we have a sturdy foundation from which to start a new business ventures. So then the question is, how do we take today's industrial strengths and make them the basis for our tomorrow? How will Korea meet the challenges of the future? The energy security, the climate changes, and the fast changing trends of a very sophisticated consumer base. We believe many of the answers can be found in our quest for new growth engines. In essence, the private sector has led the way and will continue to do so in searching for the breakthrough technology, product, and services. For someone like me in the government, all we can do is to support and make for a sound business environment for them. Market forces have already pinpointed three main areas for future growth engines. There's green, convergence, and service. Largely, they come from the need to satisfy environmental concerns, the corporate profitability, and the quality of life issues. Let me show you our new growth engines. After an exhaustive survey of industry professionals, researchers, and even university students through internet, 17 promising industries in 3 main areas were identified. At present, we consider these growth engines full of potential. But I suppose the real test will come when they succeed in the markets. Let me elaborate on some of them. First off, the one major area that is gaining traction not only among environmentalists but also corporate leaders and public policy makers is to think about the low carbon sustainable growth. That is, we call it the green growth. It means the efforts for environmental protection provides opportunities for economic growth, while the economic development helps the protection of the environment. As I mentioned earlier, we have a broad and diverse industrial portfolio. And a long tradition of maximizing energy efficiency because we have so few natural resources to start off with. Our background will help us markedly improve all aspects of our industrial structure in the race to go green. In Korea's case, new and renewable involve cutting-edge technology. Solar panels, as we all know, use the latest semiconductor production facility. So in this view, the Korea's edge in chips will be an added advantage to developing new and renewables. In another case, coal can be gasified and turned into synthetic natural gas. In the process, almost all CO2 could be captured. And there is the constant rush to put the latest products and services on the market. But to do that, source technology involves the great amounts of time, energy, and money. So instead, it is much more cost-effective to converge existing technologies into something new. That way, something new can be made available on the market with the utmost speed. Robots that clean, robots that teach, the robots that look after senior citizens, all these robots are made possible with the convergence of many different technologies. For instance, the information technology enables communication, the mechanical and electric engineering makes mobility, and artificial intelligence helps to navigate the course. Sooner or later, the robots could be a permanent fixture in our everyday lives. Another exciting field we are seeing more of these days is the convergence of high-tech semiconductors with the cars, known as intelligent cars. These automobiles can provide auto parking, self-diagnosis such as a tire pressure checking, smart keys, the driver drowsiness prevention, and auto cruise that keeps us the safety distance with the car in front. Companies exploring business opportunities will need to concentrate on quality of life issues. The service sector has great potential for growth in light of current demographic trends, low birth rate and the rapidly aging society, and the pursuit of well-being for mind and body. Let's look at telemedicine, which takes the best of information technology and high-quality health care. Patients have access to their doctors anytime, any place. This is a very fast-growing sector that could control rising healthcare costs while providing convenience for patients. Healthcare officials are encouraged that telemedicine could provide constant, long-term monitoring and care for patients of diabetes or hypertension. Another case can be contents industry. Contents industry can bring about growth of other industries such as manufacturing, tourism, and services. A famous Korean TV drama, Winter Sonata, was broadcasted in Japan, and it is estimated that 180,000 more Japanese tourists visited Korea than average during 7 months period after the show, making $33 million additional dollars in tourism revenue. I've just described the three directions, the green, the convergence, and service-oriented. Many leading companies and research institutes are looking for inspiration. We have a great capacity to innovate that comes from tremendous emphasis on research and development. We are among the top 5 countries in terms of percentage of research and development expenditure, 3.2% of GDP, and we plan to increase it 5% of GDP by year 2012. We also have an extremely talented pool of professionals, highly educated and dedicated to high standards of excellence. Almost 84% of high school graduates continue on to college. This is a remarkable number. We have more than 100,000 graduates in the sciences and engineering field every year. I would like to point out a very interesting trend that is happening recently in Korea. Companies are collaborating with one another as never before. One leading company has partnered up with a prominent small and medium enterprise to venture in the potentially lucrative biosimilar sector. We could soon see very affordable biopharmaceuticals coming out as a result of this partnership. Once fierce competitors, we have recently seen 2 corporate giants, Hyundai and Samsung, pooling their resources to form a productive alliance to develop and produce intelligent cars. This kind of a change in the corporate culture can stimulate the future growth, especially with the high-risk, high-return growth engines. We hope that such alliance in research and development can encourage further cooperation among companies over the border. Having identified these trends, the next step for the corporate sector is to actually put the plans into action. And this is where the government is trying its best to provide for the best business environment, to stimulate investment through favorable taxation schemes, deregulation, and nurturing the appropriate talent. For instance, the government is now working on a new tax bill which provides higher percentage of tax cuts for the research and development investments to share the risk at the early stage of the business. We are also working to improve the overall business environment with the deregulation and the lowering of the corporate tax rate. The current economic crisis was a wake-up call for many industries and businesses. It is no longer business as usual. We must transform and innovate to prepare for the future. The best way, of course, is to develop a new growth engines. Despite the risks involved, despite the downturn, the best plan for a sustainable future starts with a firm commitment to foster a growth engines. We are sailing toward our destination with the help of the lighthouse. The journey may not be easy, but we will be learning and experiencing many things along the way. Personally, I believe that open collaboration could substantially increase the chances for a successful voyage. On this point, I would like to stress Korea's willingness to exchange ideas and form lasting partnerships. Thank you very much, and I will be happy to answer your questions. Thank you very much.
Okay, thank you very much, Mr. Lim, for your informative and insightful presentations. And next, Dr. Nehar Bas will offer his perspectives on these issues. Please.
Hello, thank you very much for giving an opportunity following up on this very impressive presentation, trying to make a point for how biopharmaceuticals can be a future growth engine in Korea, where often it is being claimed that in Korea somehow the access to the pharma market is not feasible simply as a function of size. But the pharma market, let me explain to you, is not monolithic, and currently certainly is an industry in crisis. If you're going back and explain a little bit on where these problems come from and how solutions can be devised, let me start from the perspective of Institut Pasteur, my employer, which is probably the world's oldest biopharmaceutical company. Now, traditionally, drug discovery and development were empirical endeavors based on observation. We're going 130 years back, and you can see here, this is a picture of one of the first patients ever to be cured of rabies. And the person in the white coat was the basic researcher and the clinical researcher at the same time. Everything happened at the same moment. This, of course, is no longer feasible, although over the years it has yielded great results, many medications, millions of patients' lives saved, and not only, it has been a growth engine. And you can see here that still today, based on its ability to do translational research, Pasteur is a world leader when it comes to licensing revenues, and in addition to that, has gained 10 Nobel Prizes. But since then, a lot has changed. Currently, drug discovery is based on reductionist hypotheses and functional predictions of complex biological systems. And although that's theoretically very attractive, in practice it doesn't work very well. An industry in a crisis looks like this. You're looking in drug development at increasing cost in the face of decreasing productivity. That is never good. But to put it in a nutshell, since 1989, pharma worldwide has produced only 23 new targets. New targets are new basic disease models on which you can target a disease. If you're looking at the market with respect to the blockbusters these days, the picture is even more worrying. You can see here the world-leading pharma industries and what will happen to their major markets after 2012. And you can see that, for instance, Pfizer, 41% of their markets will basically be no longer patent protected after 2012 and will break off. And for all of the major players, about a third will disappear. So there's significant revenue loss from patent expiration, putting pressure on large pharma. And this shows that it's an industry in crisis, will open opportunities that if they are used in the right way, can open a way for Korea to position itself for the future. Now, if we look why pharma is failing, this is now a pie chart which is depicting of why drugs are not making it to market. There's a large part of strategic and financial decisions, but the crucial thing here to be pointed out is a pharma intrinsic factor, which is efficacy. Efficacy is a problem in clinical trials, and it comes up if the reductionist model systems that are being put forward in the industry in the end turn out to be unconnected to the actual physiology of the human disease. If the model system has nothing to do with the actual disease, well then efficacy will be a problem and the drug will fail. Much hope was put into the human genome sequencing project because industry was hoping by understanding the human genome, it will now be able to pinpoint all of those causes of disease and have basically new targets and develop new drugs. However, that definitely failed. The human genome, however, turned out to make absolutely fabulous markers, which now allowed the industry to realize that there are no big diseases, but there are subclasses of diseases, and genes can serve as markers for disease subclasses. So the Human Genome Project yielded markers for diseases, but not explanation. And this is a very crucial point. The recognition of disease subclasses is what is actually going to change the entire healthcare field and the pharma industry very dramatically. The emerging new trends in healthcare will lead to drastic changes in biotech and pharma. And that is based on the fact that once it was realized that there is no one big disease, but disease subclasses, now suddenly drugs could be developed much more effectively and targeted much better. Good examples for these are Tarceva, a drug that is effective in only 10% of all lung cancer patients, or Herceptin, a drug that works very well. If you recognize those 25% of the breast cancer patient that have a given genetic predisposition. Now suddenly then, drug development becomes more specific and efficient when targeting disease subclasses. And not only for the development of drugs, now if you can recognize disease subclasses, you have an entirely new angle at diagnostics. Because if you can recognize the predisposition of a patient to suffer from a disease subclass, well, there is a way into prevention, and there's an entire move from sick care to health care, investing into keeping the healthy in good and healthy conditions on the basis of having diagnostics that will allow us to recognize genetic predisposition to disease. Now then, what the Human Genome Project has yielded is these two aspects here. On one hand, an entire new angle into a personalized health care where you can see in a patient what specific disease subclass he is suffering from, and to try to develop drugs more effectively. And the same thing, the flip side of the same coin, is preventative medicine, recognizing early on the predisposition to that disease and trying to keep the patient healthy. What that does to the industry, it fragments the markets. Now this is taken from a market survey, and it tells me and it tells Pasteur and then also, of course, to you, that drugs targeted at smaller segments or markets of one will be the future. The genomic profiles will determine the segmentation and therapy, and best possible therapeutic outcome with minimal adverse events will come out of this personalized healthcare. So that means that no longer are there big blockbuster markets, but there will be niche busters, and you can actually address them when you have in your pocket at the same time the right diagnostic. So this is a fundamental change that awaits the industry. A fragmentation of disease markets with the emergence of what will be called and what is called in a keyword niche busters. The need to cater to these smaller markets faster and more flexibly, and the need for therapy and diagnostic technology to converge. Consequences: end of the blockbuster business model for big pharma, and opportunities for smaller pharma players who specialize and operate profitably in these niche markets. Question now, how can Korean pharma profit from this new environment? If we are looking at Korean pharma at this moment, there is certainly to be noticed that there is a limited background with access to biological disease models. There's little access to cutting-edge discovery capacity. There's limited capability in medicinal chemistry and pharmacokinetics. There's no common management of shared resources. This plays to corporate culture. I will come back to that. And again, the next point on the same coin, there's strong intra-Korean competition in between the pharma players in generic or me-too drugs. However, Korean pharmas as small and flexible units can cater to niche markets profitably if then the right technology is developed and implemented, address the systemic shortcomings of the current discovery process. I will explain a little bit on how that can be done and is being done in Korea. A convergence of therapy and diagnostic tool sets. Then the cost drivers have to be tackled. Classical cost drivers have to be approached with new strategies for small companies to be able to enter international markets. Cooperation, corporate culture is very important. Pharma companies have to engage in strategic and structural cooperation with a shared vision and focus, and new business models have to be fostered and incubated. Now, talking about technology, I think that there is an opportunity here for Korea to build on its outstanding IT technology, and you can effectively this traditional strengths in the face of the new demands of the health market, and that is called IT-driven BT. Now, with respect to preventative medicine, there will be a lot of IT-based connectivity and communication, connecting diagnostics to databases. This was previously alluded to before. But even on the side of the preventative, in the side of the personalized healthcare, where therapy development is being mentioned, IT-based approaches will have a lot to contribute. Korea, in form of Institut Pasteur Korea, has contributed groundbreaking technology on that side. We have come up with IT-based visual screening on living disease models to identify new drugs faster. We have developed drug optimization that can be performed rapidly in the same visual IT-driven system. And new drug targets can be systematically identified in visual IT-based array systems. Now here I was meant to play a movie, which unfortunately is not animated yet. What you were supposed to see here is a live infection process where the HIV virus is infecting a living human cell. In green, that would be a moving virus. In green, the nucleus of a human cell. And then what can be done in the meantime? We can live and in real time track and follow viruses in living human cells. The small inset was the tracking of one viral element. And by visualizing disease live as it happens, we can directly test the effect of drugs to stop disease life as it happens. And if we put that into keywords, that is an IT-driven approach to biotechnology, and it works very well. We have done this here in Korea. We have developed drugs and shown that drug development is much faster. We can compress the early discovery process down to 8 months, that addressing, of course, time and cost savings. But most importantly, the new IT-driven approach addresses one of the major systemic shortcomings of pharma these days, which is a lack of new targets. So there's a supply, and a rich supply, of both new drugs and novel targets to pharma pipelines using this approach. Now, currently making use of this Korean technology, the IT-driven approach into drug development, are the big pharmas, because they very well acknowledge what is to be gained here. Sanofi Aventis is working with Korea. Euroscreen has been successfully working with us. Boehringer Ingelheim is collaborating, and of course also LG, a Korean pharma company, is collaborating at this point. The same advantages actually kick in when you are looking at diagnostic development, because once you can visualize a disease, once you can look at a disease or a disease cell, if you want deep into the eye, you will be able to visualize disease subclasses. This, however, is development work, and there's a pressing need for concerted effort in diagnostic development on a national level here in Korea for prognosis, screening, and follow-up. Some work is already being done. I would like to mention visual array-based functional diagnostics of cancer subclasses, a collaboration done with Asan Hospital here in Korea. But let me come now to the other crucial factors in addition to the technology: cost and cooperation. If you're looking at the cost drivers, of course, technology and competence, the development to show the proof of principle, comes at a very high cost of investment. But additional cost drivers are early research and clinical research.